Controller actually is a part of the Medtronic companies, and what we focus on is building life-saving tools for life-saving teams. A life-saving team is a paramedic, a first responder, a ED nurse, a emergency room clinician, a hospital cardiologist. Those are all the people that basically we build tools for every day that actually help people save lives. What I'm going to talk about today is one of our products, one of our systems called the LifeNet system. And basically is what we did is create an ecosystem that actually utilizes products and services within the ecosystem, but also create an ecosystem that ties patients, EMS professionals, and hospitals together to deliver patient care. So when you think about a heart attack and what actually happens in a heart attack today, basically time is critical. If somebody's going to have a heart attack, within minutes, that information needs to be basically processed and be able to be sent to a clinician to actually determine how difficult this heart attack is to treat, how to treat it, because every minute basically this patient is down without that treatment, things change. You have to get the cath lab very quickly. The cath lab is actually where you'd have some type of treatment going on this patient. In logistics, think about basically in a large city like Houston, Texas, and try and get to the right hospital with that window of time is very critical. Time to treatment means less heart damage. Less heart damage means basically somebody's going to live a longer life. They're going to have less cost to the healthcare system. Financially is really one of the big drivers here. A hospital that basically gets patients treated faster gets a higher reimbursement rate, thus is more profitable. Whenever you put dollar signs involved in these equations, people start to think about how they actually really can improve things over time. So what we need to look at this system is try to identify what's really happening within this network. The patients need appropriate treatment. They need fast, rapid treatment. The EMS professionals, those paramedics in the field, need to have basic access to appropriate equipment. They need to connect to the hospital teams to be able to actually give good information such a way the hospital teams make those good diagnostic calls. And once the hospital teams engage, they have to basically alert that entire network such a way that the cath lab, the clinicians, everything operationalized such a way when that patient arrives, within minutes they can get treatment. And with any healthcare application today, or any application today, security, HIPAA, patient privacy activities, all those things are very critical to anyone involved in this activity. So we had to spend a lot of time on the infrastructure to make sure that was right. So as we look to build this ecosystem, we try to focus on really two things. What did we have? We had a large installed base of products. What was our core competency? What did we want to build, and what did we want to partner with? And basically, we wanted to make sure we didn't basically reinvent or recreate things that are already available in the marketplace today. So Physical Control is a market leader within the pre-hospital marketplace, which really those are the groups that you call 911. They show up at your house, they show up at your business, and they take care of you and give you treatment. We have over 100,000 of these LifePak devices in the field today. In fact, if you walk out the back door and see those 80s in the walls, those are Physical Control products in this facility today as well. We've got a large presence in hospitals. A lot of our hospitals today actually have Physical Control products. But more critically, we only have about 5 staff members that really work in this program to really enable the system. So in order for us to actually put together a broad system here, we actually had to go out and partner with a number of parties. So we had to actually figure out what we were going to build, what we were going to source, and what we were going to partner with. And as talked about yesterday one of the opening sessions was collaboration is one of the keys to basically ingenuity, I think, in the 2000s. And one thing we really do is figure out who we had to collaborate with in the marketplace. We had to build infrastructure. We had to worry about data connectivity, communication systems, how to do patient routing. We had to work on mobile-to-mobile infrastructure such a way you actually can move data throughout the system as well. We work in a global environment, so we had to work on a global data centers. We had to build out 3 data centers around the world. And more importantly, for all this stuff, everybody's working in healthcare, whatever business you're in, you have to have a business model that's compelling in such a way you're going to generate the levels of revenue and profits to keep this thing going. So as we look to build this infrastructure, what we really focused on was really 5 things: application development, operations management, basic data in connectivity, wireless providers. We actually ended up partnering with AT&T, Verizon, and then a wholesaler called Core as well. And we actually had to get somebody who would actually provision all these devices too. So we partnered with a group called Velocity to do that. then we utilized Savvis and GTS as our data center hosters as well. So we had a really nice network of partners involved in this project. So what we established is really this LifeNet system allows you to take patient data through wireless integration, focus on device management, and also clinical management of these patients. So I'm going to roll a short video here that really describes the system in some more detail. So that's the LifeNet system, and in order to put the system in place, we had to develop not only a series of applications, series of technologies, but then we actually also had to go through and build out a bunch of actually partner networks as well. So I want to highlight what we actually learned in this process, because this wasn't an idea we have going forward, this is an idea we had in the past, so we've actually got some history and learning here. We actually chose GlobalLogic, we chose Savvis, we chose Multitech with very strong choices, and we chose partner networks. We actually had to find provisioning partners and broadband partners to create these customer activities. And we found major implementation issues as we tried to actually get small EMS service provision on Verizon networks, for example, and AT&T networks. It was really a very difficult thing, but we eventually worked through that. We had developed a new ASP business model. We were selling a service. And for a lot of our customers, that was a very foreign activity to them. And so we had to work through that process to get them to be comfortable with a new business model. And finally, patient privacy, information like that was just very critical to our customers. So we had a number of security audits with third parties to go through this process. So what we've done over the period of the last few years, we've introduced the product in 2007, and we keep iterating it every year with major releases. We now have over 15,000 LifePaks enabled, so groups in the field actually can do 12-lead activities with over 4,000 EMS customers. We have over 60% of all the PCI capable, basically all the cardiology hospitals in the United States on LifeNet today. And we do on a monthly basis about 250,000 transmissions. And that means 250,000 times on a monthly basis, a 12-lead of a patient actually having a critical patient condition is transmitted to a hospital to do review and oversight and do clinical diagnosis off of. But the major thing on this is, from an outcome standpoint, once we put the system together, we've had hundreds of thousands of patients are now being served differently and being treated throughout the system. And we've enabled EMS professionals in the field to actually work with hospital systems to better patient care. Thank you very much.